Are you leaving money on the table by not using the G2211 add-on code? Well, today I'm going to show you exactly when and how to use this code to properly capture the complexity of your patient's visit. So stay tuned. Hello everyone, and welcome back to the channel. If you're new here, you don't know me yet. I'm Clarice Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies regarding health information, healthcare compliance, the revenue cycle, and how to become a certified marketable medical coder. Today, we're diving deep into something that could significantly impact your practice's revenue, the G2211 add-on code. But before we get started, hit that subscribe button and ring the bell so you never miss our regular coding and billing tips. Did you know that many practices are missing out on legitimate reimbursement opportunities because they're unclear about when to use the G2211 add-on code? Well, that changes today. Let's start with the basics. G2211 is an add-on code that describes visit complexity inherent to evaluation and management associated with medical care services that serve as the continuing focal point for all needed healthcare services and or with medical care services that are part of ongoing care related to a patient's single serious condition or a complex condition. In simpler terms, this code captures the inherent complexity of evaluation and management visits, particularly when you're the continuing focal point for all needed healthcare services or when you're providing ongoing care for a serious or complex condition. Now, let's break that down into more practical terms. First, let's talk about who can bill this code. Any medical professional who bills Medicare for office or outpatient E&M visits can use G2211. We're talking about those visits coded with 99202 through 99205 for new patients and 99211 through 99215 for established patients. Now, here's where many practices get confused. You might be wondering, well, Clarice, when exactly should I use this code? Well, again, let me break it down for you with some real world examples. So let's say you're a primary care physician managing a patient's multiple chronic conditions. You're the one coordinating all their care, making referrals, and keeping track of their overall health. That's a perfect scenario for using G2211. Or maybe you're a specialist managing a patient with a complex condition like sickle cell disease or HIV. You're providing ongoing care and developing comprehensive treatment plans. Again, G2211 would be appropriate here. But here's what's crucial to understand, and I see practices miss this all the time. G2211 is not appropriate for one-time procedures like mole removal or treatment of simple viral infections, basic seasonal allergy counseling, or when you're not planning to provide ongoing care. So let's talk documentation. Now, here's some good news. There are no additional documentation requirements specifically for G2211. But don't get too excited. You still need to ensure your medical record supports the medical necessity of the visit, the nature of your ongoing patient relationship, your comprehensive care plan, and your claims history and regular documentation should naturally support the use of G2211. If you're providing comprehensive continuous care, it should be evident in your records. That's a pro tip. So now let's discuss practice settings. You can bill G2211 in both facility and non-facility settings. But here's something important. If you're working in an FQHC or RHC. G2211 is bundled into your encounter rate, so there's no separate payment there. Here's something else that might surprise you. G2211 can be appropriate in team-based care settings. If your patient sees different providers within your group practice, you can still bill G2211 as long as you're providing that continuous, comprehensive care as a team. Now, let me share some exciting news about changes that have come into play in 2025. So starting January 1st, Medicare will allow payment for G2211 when you report it on the same day as annual wellness visits, vaccine administrations, and any Medicare Part B preventive services. Now that is a huge win for practices. It means you'll be able to capture the complexity of care even during these important preventive visits. One quick note about patient responsibility. Yes, the usual Part B coinsurance and deductible apply to G2211. Make sure your staff knows this for proper patient communication. Oh, and here is another bonus tip. You can bill G2211 during the same service period as care management services. They're not considered duplicative because G2211 recognizes the complexity of the visit itself, while care management codes cover services outside the visit. So before we wrap up, let me give you 5 golden rules to remember. The visit code. First, always link G2211 to an office or outpatient E&M. It's the add-on code and can't stand alone. Second, make sure you have ongoing relationships with the patient. This isn't for one and done visits. Number 3, document the complexity of care appropriate. Let your records tell the story. Number 4, consider your practice setting. Remember those special rules for FQHCs and RHCs. And number 5, keep an eye on those modifier rules. They're changing in 2025. So here's your quick tip sheet, if you will, for your billing staff. So remember, for 2024, you need to verify Medicare as the primary insurance, ensure proper E&M code linkage, and note that G2211 will be denied with modifier 25, as well as apply the standard Part B cost sharing. Now, all of that was provided to us in 2024. Now in 2025, you can bill G2211 with annual wellness visits, vaccine administration, Part B preventive services. So make sure you document both preventive and complexity elements, and continue applying standard cost sharing rules. Make sure you prepare your billing systems now for these changes. It's never too late to update your process, especially if this is new to you. So that's all for today's video. If you found this helpful, please give it a thumbs up and share it with your colleagues. And if you want to stay up to date with the latest coding and billing updates, join our PRN family at bit.ly or bit.ly/the PRN Sippers. And by becoming one of the PRN Sippers, you'll join a community of sharp minds who savor the complexities of the healthcare revenue cycle. And here's what you can expect as a valued member of the Sippers. Exclusive healthcare insights. So gain access to in-depth articles, webinars, and resources covering the latest healthcare trends, compliance updates, and revenue cycle best practices. Early access. Be the first to receive expert insights and guides, ensuring you stay ahead in the ever-evolving healthcare industry. Personalized support. Enjoy direct access to our team of experts for guidance on medical coding, compliance issues, and revenue cycle management. We're here to answer your questions and support your professional growth. And finally, my personal favorite, community connection. Join a private community of healthcare professionals where you can network, share experiences, and of course, collaborate on finding solutions to common challenges. Your support means the world to us, and we look forward to helping you excel in the world of health information and healthcare revenue cycle. So until next time, I'm Clarice Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And if you want to know more about medical coding, compliance, the revenue cycle, and healthcare in general, well then watch one of these videos. Remember, be safe, be kind, and don't wish for it, work for it. Thanks so much for watching.